Hello, so I'm going to be doing the tracheostomy suctioning skill in this video, and I'm starting now. So my client has been coughing to clear their trach because it appears that they have some secretions in their trach, so I'm going to be going in to help them. Okay, so I'm going in now. Hello, my name is Vado. I'm one of the nursing students working in this unit today with your nurse. Can I please have you verify your first and last name and your date of birth? George Patel, 10/17/55. Thank you very much. So the reason for my visit is because you had mentioned that you're having to cough to try to clear up some secretions in your trach and you're having difficulty with it, so I'm here to help you with that, okay? Are you having any pain at the moment? Can you rate it from 0 to 10, 0 being no pain at all, 10 being the worst pain ever? You're having about a 0? Perfect. So from this moment, I would be assessing my client's vital signs, lung sounds, and also their ability to clear their own airway. Also to note that everything that I need is on the bedside right next to them to make sure that any tools that I need, I have it available to me. So if they need, if I need a trach set, if I need obturator or 10 milliliter syringe, I have that available for me. So from here, I'm gonna be grabbing a clean towel and putting it over my client's chest to make sure that I have that there. Okay, so from here, I'm gonna be moving the bed upward, and I'm going to be moving the head of the bed a little bit higher up to make it easier. I see that my client's in a comfortable position for me to be able to continue with the procedure. So from this point, I would be putting on my gloves. Also to note, my client already has a pulse oximeter to make sure that I check the O2 sats and make sure that during the procedure that they don't change or anything like that, so I'm able to see that. So they have that on this entire time. So from here, I'm going to be then going over to check for the suctioning device and suctioning and make sure that it's between -80 to -120. If it's anything over than that, I would have to make sure that it's adjusted. So from here, I grab my tubing, my suction tubing, and make sure that I add an oral suctioning device, and I'm going to be suctioning their mouth to make sure that if there's any secretions built up in there, that I remove that first. So once I have done that, I'm able to then use some normal saline and clear up the secretions that are built up in the oral suctioning device. And from here, I'm ready to take that off, put it away, and then have my tubing be nearby for and easily accessible. So here. From here, I also noted that I had seen the client's O2 sats, and they didn't appear to have changed drastically or anything like that, and they're doing good. From here, I'm able to then take off my gloves and hand hygiene. So at this point, I would clear up my workstation and make sure that it's well disinfected, and I have everything that I need for me to be able to do the suctioning for their trach. So that includes sterile gloves, my 14 French suctioning catheter, and also my saline solution, my normal saline solution. So from here, I'm able to then continue. So I'm just going to be opening up. Going to be opening up, loosening up the cap right here, and I'm going to be opening this one up. Okay, so from here, I'm going to be removing, I'm just going to be moving this a little bit forward. I'm going to be then grabbing this right here. Make sure that's fine. Okay, from here. And I'm going to be filling that about halfway. I'll close this up. Okay, from here I'm going to be putting on my next glove. Going to be getting my next glove. Here I'm going to be putting it on. Okay, so I'm still good. From here, I'm going to be able to grab my tubing. And I'm able to do that, make sure that it is ready. So from here, I'm going to be then using my non-dominant hand to grab my tubing. Okay, from here, I'm going to be then putting it on. Okay, so since it's connected to suctioning, it is going to be suctioning, but I do want to test it out beforehand really briefly. So I'm going to be just checking with the normal saline. Just going to be checking really briefly and make sure that it is, and it is suctioning well. So from here, I'm able to then go to my client's trach, but they most likely do have a an O2 collar, so I'm just going to be moving that really briefly. From here, I'm able to then grab my normal saline, I'm going to be grabbing my tubing, and from here, I'm going to be then going into my client's trach, and once I've met resistance, I'm going to move up about 1 centimeter, and from here I'm going to be suctioning intermittently and rotating and moving upward. I'm going to be doing this no more than 10 seconds, and I would be noting if my client was grimacing or severely coughing or anything like that, and I would just be assessing how they took the procedure and also their O2 sats, if they dropped or anything like that. My client did not appear to have had that. They appear to have taken the procedure well, and their O2 sats only dropped to 96 instead of 99 that's their baseline. So it didn't drop too much, but from here, it appears that they're doing good. So from here, I would then just suction with normal saline just to remove the secretions. And from here, I'm done with the procedure, and then I can just move the O2 collar back on their trach. So from here, I'm able to then just discard the dirty items. So then I put the tubing back, turn off the suctioning because I don't need it at the moment, and just discard everything that I have that has been used and dirty. Make sure that that goes to the trash. Hand hygiene. And from here, like I said, I would be then assessing the O2 sats, and I put back the collar on my client, the O2 collar back on my client. The O2 sats are back to their baseline at 99, and also I would be assessing the lung sounds to make sure that they're doing good. From here, Mr. Patel, I'm already done with the procedure. If you have any questions, nope, you don't? Perfect. So then I'm going to be lowering the bed, and from here, I have the call light on the left-hand side of the patient. If you need anything, Mr. Patel, please press the call light. Thank you very much. Okay? Cool. So hand hygiene, I'd be closing the door, and from here I would be documenting the secretions, so coca. I would be documenting the assessment that I did on the patient, the vital signs, and also how the patient took the procedure. Thank you.